5 on your health tonight, a national spike in the number of Americans dying from alcohol.
So experts say the sharpest surge is among young women. Joining us now is Dr. Ali Raja, Vice Chair of Emergency Medicine at Mass General Brigham. Dr. Raja, thanks for being with us.
Thanks, Ben.
All right, so you've taken a look at this research. What qualifies as a death from alcohol?
Ben, researchers really look at two types of cases. So the first is when alcohol is the direct cause of death. That includes things like liver damage from years of drinking. The second type is when alcohol clearly plays a role in the death, even if it's not the only factor, like car crashes or falls or other injuries. But it's also important to note that these numbers don't include long-term diseases that alcohol can make more likely, like heart disease or cancer. They only count the deaths where alcohol is a direct part of what happened.
Okay, so understanding that definition, let's look at the data from the CDC. So they're saying in the past 25 years, deaths from alcohol increased 89%. But for women between the ages of 25 and 34, it jumped 255%. Do researchers understand why this is?
That's such a good question, Erica. You know, there's not a single reason, but there are some clear trends in the research. Men still die from alcohol at higher rates, but that gap is really shrinking. According to those data, more younger women today are drinking at levels similar to younger men, and alcohol is often marketed directly to them. There's also new data showing that black women are now dying at higher rates than black men. And so that tells us this is a really growing public health problem. And experts also point out that we've not done enough research on how alcohol actually affects women differently. And without that information, people may not realize, for example, that smaller amounts of alcohol can harm women more than men.
All right, so do you typically test for alcohol intoxication when a patient arrives in your ER?
Ben, we often do. I mean, alcohol can be involved in many of the most serious emergencies we see, like car crashes or falls or assaults. We also see a lot more alcohol-related patients during the holidays, which is really unfortunate. It can make all sorts of treatment more complicated, and it can make it harder for us to get information from patients. But I can tell you, it's always something that we talk to patients about. And the good news is that, fortunately, a visit to the ER can sometimes be the wake-up call that our patients really need to make real changes in their lives.
Okay, well, Dr. Raja, thank you, as always, for joining us.
Thank you.
Thanks, sir.